the light? The light is this one. The light. Yeah, the back is fine, just in front, because, yeah, that's fine. Yeah, that's fine. Okay. Come front, because the speaker, it doesn't work. It's better to come in front to hear what I'm saying. Can you hear me there? Yes? If you can hear, that's fine. If not, please come in front. Quicker. Okay, so today I'm going to talk about humoral immunity. Dr. Talat already told you cell-mediated immunity. They told you how T cells involve in the immune response. So today I'm talking about the role of the B cells. Learning objective is there, so it is important to follow that when you're reading. One thing I can tell you, if something you don't understand it, you have two options. One option is go to the library to find a book and find the subject that you don't understand on the back of the book. They call it glossary. You know, for example, cell-mediated immunity. They tell you which page to go. You can go and read it. And still you can understand it, come to my office. You're welcome anytime. I'll be in the office 8 o'clock to after Salat every day except Wednesday, because I go to the hospital. So if you don't understand it, just come to ask me questions. But it's two-way. First, go to the library, because you have to be rely to yourself first. You is more important, because if you could sort your problem with yourself, you never face any problem in future. You cannot rely to anyone. But if it still is hard to understand, you can come to my office anytime, okay? So today I'm going to talk about the humoral immunity. So we mentioned this figure was for a couple of times. So antigen cause immune response, activate innate immunity or acquired immunity. And the acquired immunity is divided to two groups, which one of them is cell-mediated immunity, which T-cell memory responds for that by production of the cytokine, and the cytokine activate other cells to kill the pathogen. And the B-cell humoral response is rely on the B-cells by production of antibody. So in T-cell immune response, cell-mediated immune response, you was told that the only protein antigen is important, because the T-cell can only recognize protein antigen in the form of peptide. So they cannot recognize any other antigen. So the protein antigen is very important for cell-mediated. But for humoral immunity, as you can see, there is a lot of type of antigen can be recognized and function against them. So one of them is extracellular bacteria. It is a toxin that the bacteria usually use, like diphtheria. And also the most important one is those bacteria which have a capsule. And the capsule mainly is made by polysaccharide and lipid. And the other thing that also the humoral immunity do, they stop re-entry of the intracellular. For example, intracellular, we mentioned, whenever they go to the host, they go inside the cells. As far as they are inside the cells, humoral immunity cannot do anything. It is the job of cell-mediated immunity to kill them. But sometimes when the pathogen are inside the cells, they kill the cells and come out and go to the other cells. When they come out, the humoral immunity captures them and neutralizes them. So you understand what the re-entry means.
You mean in the humoral response functions, this is their bacteria or microbes in the body or in the cells, immediately working, or there is something else?
Yeah, but the main thing that actually it's a good question, because what this immunology course means to you, we usually talking about how immune system confronted the pathogen. But confronted to other thing, it is completely different story. For example, in autoimmunity, in cancer, in transplantation, the form of the immune response is completely different. So what you was told is usually telling you how the immune system confront the pathogen, including all microbes, parasites, virus, and bacteria. Yeah, mainly it's talking about the infection, nothing else. Because if you want to know more, you have to go read by yourself. And actually, the good thing about this course is they make you enable, if you understand it well, if you read it well, it makes you enable to go to read other books to understand. It gives you basic information. So when you have a basic information, you can go to read it. For example, you go to primary school to learn Arabic. After you finish the primary school, you can read the newspaper, because in the primary school, they didn't tell you how to read the newspaper, but they give you a tool to read it. Exactly, this course is doing the same thing. They make you enable to go to read the book. And you have to read the book. Be remember, have to read the book, because if you don't read it, you will be behind. Okay, so B cells, in contrast to T cells, which recognize protein as a peptide, they can recognize protein, they can recognize hapten, polysaccharide, lipid, and nucleic acid. But T cell only, as I mentioned, they can recognize protein as a peptide. Like T cells, B cells also is divided in 3 different groups, and each group have different function. And we will go through the function of these subset one by one. So one of them is follicular B cells, and another is, we call it marginal zone B cells, and another is B1 cells. As I said, their generation, their function is completely different from one to another. They also express different markers on the cell surface. By using these markers, we can recognize which B cell they are. For example, the mark of the B1 cells is CD5 positive. If they are positive all, we know it is the B1 cell. And as you can see here, the follicular B cell, for example, doesn't express CD5. By using the combination of the marker, we can recognize the type of the cells. We mentioned already that the CD marker are important in 3 different categories. First is diagnosis. We can recognize the type of the cell. The second is the migration, because they use different marker for the moving from one to another. Another main function was when they interact with each other, they activate the cells, activation, which causes function of the cells. So the markers, CD markers, are very important. So as you can see here, we use these markers to differentiate which cell they are. So it is different subset of the B cell. We said follicular B cells, and marginal zone B cells, and also we say B1 cell. As you can see here, follicular B cells, they usually located in the spleen. Do you have any marker? Because I don't know, the battery I think is out. I can't use it very much. Anybody have a marker like that? Pointer, yeah. No? Nobody have it, okay. So that is the spleen. They usually, follicular B cell is in a spleen. They only recognize protein antigen. Only these cells recognize protein antigen. Since they can recognize protein antigen, that's why they need to be held by T cells. So when the B cell recognize protein antigen, cannot do anything by itself. They need to be held by T cells. That's why they call it T-dependent immune response. Because they, to be function, they require help from the T cell, which when the T cell activated, they produce cytokine, and the cytokine help the B cell to be function. So follicular B cell are in this spleen, and they are T cell dependent, because the antigen they can confront is only protein, and if the antigen is protein, the B cell cannot do by itself. They need help. We will tell you why they need help. And also there is another B cell, is marginal zone B cells. They're located also in lymph node and spleen, but they only recognize lipid and polysaccharide. In contrast, the follicular B cells, which produce long-lived plasma cells, they produce short-lived plasma cells, and these cells produce mainly IgG, IgE, and IgA, but this one mainly produce just IgM. So they are different in the function. They recognize different antigen, and they produce different antibody. The B1 B cells also, it is mainly are in the mucus, is in the peritoneal cavity, is full of the B1 cells, and their function is to recognize polysaccharide and lipid. Like the marginal zone B cells, they produce just IgM, by a little bit IgG, but mainly the antibody is IgM. So the antibody production of these two cells is identical, but the follicular B cells produce mainly other isotype of the immunoglobulin. Whenever you don't understand it, just let me know, okay? It is how the follicular B cell is responding. So the follicular B cells, which express IgM and IgD, they recognize the antigen, and to become activated, they need to be helped by T cells. When the T cells give them help, they have a clonal expansion. So from one single clone, you produce plenty of the B cell to be able to confront the pathogen. So when they become clonal expansion, as we mentioned, they differentiate in different, because their job have to be different. So some of them directly go to plasma cells, produce IgM. That's why the IgM come first in any infection. Any infection, IgM antibody raised in the beginning, because they quickly go to produce IgM. Some of them, they become short-lived plasma cell, they produce IgG, but just a small amount. But some of them go to the germinal center. This one, the bottom one, go to the germinal center, and they produce a lot of IgG producing plasma cell and also memory cells. So when they become activated, they differentiate in different functions. Some of them IgM producing cell, some of them short-lived plasma cells produce a small amount of IgG, but the main important one is actually those who goes to the germinal center, which tell you where the germinal center are. They go to the germinal center, and in the germinal center, they produce plasma cells which are able to make IgG and IgE and others. If they don't go to the germinal center, they cannot make it. And also, they produce memory cells in the germinal center. So in the germinal center, not only they produce high affinity IgG antibody, but also they produce memory cells. So this is the structure of the immunoglobulin. You should know that. You have Fab section, which function is and you have a FSC function. The function of the Fab is the binding with the antigen, and it is in this area. It is in this area that somatic mutation and affinity maturation happen. We will tell you what these two means. Affinity maturation means they become more effective because they have a somatic mutation. We'll tell you more about that, don't worry. And then we have a FSC fraction. Yeah, and also in this part, they have three CDR section, which is very important to binding with the antigen, which Dr. Imad already talked about that. And the FSC fraction of the antibody are responsible for the functional part. So the Fab bind with the antigen, the function based on the FSC fraction, whether it is IgG or IgE or IgM, it is the FSC part tell the cells and signal what to do. And when we talk about isotype switching, it happened in the FSC portion. It is what I told you so far.
Dependence.
Which one?
Are there this for this section?
For the,
Are there attendance?
pardon?
Attendance. Are there?
Yeah, I think this I have the. Okay, the antigen, we mentioned the antigen bind with the T cells which express IgM, IgD. They become activated, clonal expansion, proliferation, and then differentiation. They become memory cell and plasma cell. First they produce IgM, and then they have isotype switching and affinity maturation, which ended to production of the other immunoglobulin. It is what I told so far. Pardon?
Why the first IgM?
When Ig come, yeah, I will tell you later. Yeah, because it is here. So one of the function of the germinal center, we said isotype switching and affinity maturation. For such a reaction, this interaction is very important. CD40 ligand is very important plus cytokine. CD40 is expressed on the B cells and CD40 ligand on T cell. So it is the way the T cell and B cell talk in the germinal center. If there is a mutation in CD40 ligand, the patients suffer in production of the IgG. So mainly they just can produce IgM. That's why they say X-linked hyper IgM syndrome. So if this reaction doesn't happen, the affinity maturation, somatic maturation, and also isotype switching is not going to happen. So that's why the CD40 ligand is crucial for production of the high affinity antibody. What the somatic maturation means is actually rearrangement of the immunoglobulin V region. You know, when we mention about the variable section of the immunoglobulin, we mentioned we have a V region that produced by different genes, about 100 genes. What the somatic maturation do, they rearrange it again to be fit with the antigen. To understand it better, I can give you example. When you lose your key, you go to the key shop and tell them, I want to duplicate this one. So what they do, they put your key and put the blank one there and turn on the machine, finish. When they finish, if you use that one, that key cannot open your door properly. What they do, they usually, you go and try it and say, no, it's not good. And then you come back, what he do, he brush it. When he brush it, you go there and you open it quickly. It is exactly by rearrangement of the IgG happen in the V region of the variable region of the antibody. It make it fit to bind with the antigen properly and quickly. That's why when they fit, we says it increase affinity maturation. So it increase the affinity, it increase the binding. There is nothing. Nothing is happening. Not go to the IgG. No, just the IgM. Yeah. Because if you remember this figure, so this part is not going to happen. So you don't have a memory cell. You don't have any high affinity antibody because here is induced in germinal center. If those signal is not, you don't have a germinal center. You have just this part and this part. Yeah, and also they make germinal center, and finally they make the memory cells which go to the bone marrow and peripheral blood. Yeah, I'll get it. Go little by little. So important factors in B cell response. As one we say is structure of the antigen and the type of antigen. So if it is intracellular, the function is different. Is extracellular, is different. is a toxin is different. So structure of the antigen is very important. And location of the antigen, if it is intracellular, is different from extra. So structure of the antigen is very important. Concentration of the antigen is important. How much the pathogen get into your system is important. And yeah, the structure, polysaccharide and protein. Previous exposure is different. And also rule of T cell, because some of them is T cell dependent and some of them is T cell independent. The previous exposure we'll tell you later. And then it is important how the antigen get into the system. If it goes to the blood, the antigen will capture in the spleen. But if you go to the skin or mucosal lymphoid tissue, or you inhale, go to the respiratory function, the pathogen goes to the lymph node. If you remember the picture of the lymph node, you will realize, I told you before, why there is too many lymph nodes around the mucosal tissue. So if they go through the mucosal tissue, directly go to the lymph node. If you remember the picture of the man with lymph node, you can remember it. That's why it is important for you. Immunology, you have to learn the previous lecture. If you don't learn the previous lecture, sometimes it's difficult to understand what I am saying. Okay, it is the first response and second response. We mentioned previous response mean that.
About the affinity, do you mean the affinity, the activation of the B cells?
No, affinity, it means the binding of the, that's why I told you, if you didn't brush the key, you cannot open the lock very well. They don't go quickly. But if you brush it, they go quickly and faster.
It's more movement.
Yeah, and I'll talk about the affinity again. Still, there is some part that I have to tell you. It's not finished yet. So I forgot to bring my water, so you can, where's the, yeah. Meantime, if you have a question, ask me, I'll tell you. Yeah, they just mark those who are here and not. Yeah, that's right. No, this one. This one. Yeah. No, you can call them, because sometimes when the students get this one, they put some mark on the previous one. So I don't want to do that. Somebody have to call them and put the mark there. Actually, it is pity because we trust you, but you don't do it properly. Yeah, you have to call and put the mark there. Somebody just called, yeah. Yeah, call the name and mark it. If they are here, they put the mark here. Yeah, you can do it then, yeah. Pardon?
Your focus on
Yeah, most of the time. Most of the time I'm there. Huh?
from 8 morning
8 o'clock, yeah, usually I come 8 o'clock. Till 12, 12:30, and then Salat, and after Salat I go. Yeah, usually, most of the time.